Because it is estimated that about 70% to 80% of pregnant women experience morning sickness, there is a room for a lot of misinformation. Included in these misinformations are old wives' tales and other myths, which is very common, and I believe that you've even heard a lot of these misinformations about morning sickness. Hello, welcome to my channel. My name is Bevelyn Ofori. In today's video, we are going to talk about some of the questions that are being asked a lot about morning sickness and answers to these kind of questions. The first question is, why is it called morning sickness when you can also experience it all night? The answer is, even though nausea and vomiting during pregnancy is commonly called morning sickness, it doesn't mean that you are only going to experience this in the morning. No, you can experience nausea and vomiting or morning sickness either at the day or night. Don't be misinformed that because it is commonly called morning sickness, you are only going to experience it only in the morning. Even though some pregnant women feel like they are more nauseated during the morning than other time of the day, it doesn't mean that you are only going to experience morning sickness just in the morning. It's different with everybody, all right? Everybody is going to experience the morning sickness differently, but remember that you can experience morning sickness at any time of the day or night. The next question is, are you having a girl if your morning sickness is bad? It's being misinformed that if you are experiencing severe form of morning sickness or your morning sickness is really bad, it means that you're going to have a girl. It's not true. So don't be misinformed that if you are having a severe form of morning sickness or your morning sickness is bad, it means that you're going to have a girl. You can experience morning sickness whether you are having a girl or a boy. Morning sickness don't determine the sex of your baby. Even though studies show that women who have morning sickness severely enough to be hospitalized during their pregnancy were slightly more likely to have girls rather than boys, there is nothing that is backing this research. So how bad your morning sickness is during pregnancy can't predict the sex of your baby. The next question is your pregnancy healthy if you don't have morning sickness? Even though morning sickness affects a lot of women during pregnancy, it is not a key to determine whether your pregnancy is healthy or not. Many women are able to have a healthy pregnancy without even being sick at once or without even experiencing any morning sickness during their pregnancy. Nausea and vomiting during pregnancy is thought to be caused by the rise of pregnancy hormones and other things during pregnancy. Because every pregnancy is different, experiencing morning sickness during your pregnancy does not determine whether your pregnancy is healthy or not. Is your baby okay if your morning sickness disappears? In general, morning sickness goes away at the end of the first trimester. A lot of women experience morning sickness around the 4th to 6th weeks of pregnancy, and it usually goes away towards the end of the first trimester or whilst your pregnancy is advancing. So if your morning sickness disappears, it doesn't mean that your baby is not okay. But if you feel like your morning sickness suddenly disappeared and you are worried about how you are feeling, you can talk to your doctor or midwife, because sometimes this could be a sign of problem such as impending miscarriage, or it could be a non-issue. The fifth one is, when should you go to see your doctor if you are worried about your morning sickness? Being ill is not fun. Anybody who have experienced morning sickness or nausea and vomiting during pregnancy will tell you that this is not a joke at all. Like, you may feel sick or you may be sick, and sometimes you cannot even hold down just water. There are women who are not even able to eat or drink anything because of their nausea. Like, their nausea is very bad, and others to be able to eat something, but immediately they eat it, they will vomit everything out. And nausea and vomiting can be very stressful, and it can lead to a lot of health issues during pregnancy. So if you feel like you are not being able to cope with your nausea and vomiting and you are worried about how severe it is, you have to speak to your doctor. You should call your doctor or midwife if 1, you are losing weight, you are dehydrated, you can't function at work, you can't function at home. Your urine is very small or scanty. The color of your urine is very dark and you always feel dizzy. Please speak to your doctor or midwife because this can lead to other serious health issues or conditions in pregnancy, and you may need a medical assistant or help for you to maintain your health in pregnancy. The sixth one is, what medications can you take when you are experiencing morning sickness? Self-medication during pregnancy is not advisable. Whenever you are pregnant, make sure that you speak to your doctor or midwife whenever you want to take any form of medication. They are the people who are supposed to prescribe medication for you during pregnancy when they feel like there is a need for them to do that. So whenever you are having issues with your morning sickness and you want to try other form of medication or other form of help out there, please talk to your doctor or midwife. They are going to give you the best advice on what you have to do and what not to do. Don't take any medication by yourself to treat your nausea and vomiting during pregnancy. Speak to your doctor and midwife for them to assist you or for them to prescribe the proper medication for you to take. The next one is morning sickness dangerous? Yes, morning sickness can be dangerous if you are experiencing it in the extreme or severe form. The severe form of morning sickness is called hyperemesis gravidarum, which is the extreme vomiting that can cause dehydration and weight loss, and that one can be dangerous. But if you are experiencing your morning sickness in the normal form, it's not really extreme, you are able to hold something down, and you are not vomiting a lot or you are not losing a lot of weight, then that's fine, because during pregnancy you are likely to experience morning sickness. But if you feel like you are having the extreme form of morning sickness, always vomiting, you are dehydrated, you are losing weight, you can't hold anything down, you feel very dizzy and lightheaded, please speak to your doctor and midwife because it can be very dangerous. Sometimes the severe form of nausea and vomiting need to be treated at the hospital, and even some pregnant women are hospitalized when they are experiencing the severe form of morning sickness. The next question is, every woman have to experience morning sickness during pregnancy? This is not true. Even though it's one of the common signs of pregnancy, not every woman experiences this. So it's different with everybody. Some will and others too will not. And even with the severity and the length of the morning sickness is even different from woman to woman. Some women will experience the morning sickness at its peak during the first trimester, and it ease a bit getting to the second trimester or the third trimester. Others too experience morning sickness throughout their entire pregnancy. The next question is every morning sickness associated with pregnancy? The answer is no. Even though morning sickness is a common sign of pregnancy, other health issues other than pregnancy can also cause you to experience nausea and vomiting. So whenever you feel like you are being nauseated or you are vomiting and you are not sure whether you are pregnant or not, the first thing that you have to do is to take a pregnancy test to confirm pregnancy. If you are pregnant, then it means that your pregnancy is causing you to feel nauseated or vomit. If you are not pregnant, then it's important to speak to your doctor or midwife for them to rule out any other health conditions which is causing you to be nauseated or vomit. This is the end of this video. See you in my next video. Bye bye.